Okay, this is Chapter 6 Cardio, and in this video we'll be discussing beta adrenergic blockers by generation. So beta blockers are a pretty common drug class, and they're especially used for patients who have heart failure and in patients after they have had a heart attack. So we'll have 4 examples of medications today. 3 of them will be considered beta blockers, and then we'll also compare that to an alpha blocker. So alpha and beta are different receptors that are seen in the sympathetic nervous system, and there are 2 different types of beta blockers. So beta 1 is a receptor that's found in the heart, and when we stimulate that, we increase the heart rate. Beta 2 receptors are found in the lungs, and when we stimulate that, we see bronchodilation or improvement of breathing. So if we were to block beta 1, we would see a decrease in heart rate, and then if we block beta 2, that would be actually bad, and we would see bronchoconstriction in the lungs. So we have 3 different generations of beta blockers. So our first generation beta blocker is propranolol or Inderal. So first generation just means that it is non-beta selective. So it's good that it hits beta 1 in the heart to lower the heart rate, but it's bad in that it hits beta 2 in the lungs, so then we get bronchoconstriction. We can remember how propranolol works by hitting both beta 1 and beta 2 by remembering the brand name Inderal, and the end says all, or all the beta receptors. Our example of a second generation beta blocker is Metoprolol. There's 2 different brand names. There's low pressor and Toprol XL. And Metoprolol is a beta 1 selective, otherwise known as cardioselective beta blocker. So it works in the heart to decrease the heart rate. Unfortunately, when we lower our heart rate, our body compensates by constricting our arterioles, which can then lead to a slight increase in blood pressure. So there's 2 salt forms of metoprolol. The low pressor is metoprolol tartrate, which is short-acting and dosed twice daily. And then the Toprolol XL is the metoprolol succinate salt form, and that's long-acting. So we can remember that that one is long-acting because the brand name ends in XL. Our example of a third generation beta blocker is carvedilol or Coreg. So third generation blocks both beta 1 and beta 2. So we get a decrease in heart rate, but we also get that bronchoconstriction, and it also blocks alpha 1. And so since it blocks alpha, it leads to vasodilation, which can better control blood pressure. So we don't have to see the typical stem of olol with carvedilol. We see the I instead of the O. But we can remember that carvedilol works a little bit differently by remembering the dil part of carvedilol, so we can think of that as dilating. And then our last example is just for comparison. It's an alpha blocker. So doxazosin or Cardura is our example. And alpha blockers work to relax smooth muscle in the bladder neck and prostatic capsule. So then we can use this for benign prostatic hyperplasia, which can lead to difficulty urinating, especially in older men. And then doxazosin, since it is a non-selective alpha blocker, can also be used to lower blood pressure as well with its vasodilatory effects. So now we'll go over some practice questions. So a beta blocker that is an alpha blocker also is, and then these 4 answers will remain the same throughout the rest of the video. So A, propranolol, B, metoprolol, C, carvedilol, and D, doxazosin. So the correct answer is C, carvedilol, because as you recall, it blocks alpha and beta. And A and B are incorrect, propranolol and metoprolol, because those both just work on beta. And then D, doxazosin, is incorrect because it has no effect on beta, but it does block alpha. So for the remaining 3 questions, we will change the question to make each answer correct. So question 3, make A correct. A beta blocker that should be used with caution in asthmatics is, and the correct answer is A, propranolol. So propranolol blocks beta 2 receptors in the lungs, and so it can lead to the bronchoconstriction, which would be bad in asthmatic patients who already have constriction problems in their lungs. So metoprolol, carvedilol, and doxazosin don't work quite as hard on the beta-2 receptors, or they don't quite work there at all, and so those can be used just fine in patients who have asthma. Practice question 4, a beta blocker that is selective for beta-2 receptors in the heart is, so the correct answer is B, metoprolol, because it is beta selective or cardioselective. Propranolol is incorrect because it also blocks beta-2 in the lungs. Carvedilol is incorrect because it is selective for beta-1, but it also blocks alpha receptors. And then doxazosin is incorrect because it is just an alpha blocker. Practice question 4, an alpha blocker that is used for BPH and hypertension is, and the correct answer is D, doxazosin. It is an alpha blocker which is indicated for both of those disease states. And A and B, propranolol and metoprolol, are incorrect because they only work on beta receptors. And carvedilol, while it does work on alpha receptors, there is no indication for BPH, but it can be used for hypertension.